So is there anything you can do for this face of mine?
There's lots of things we can do for this face. If you don't do anything else for your skin, the most important thing would be sunscreen every day.
Okay.
Do you do that? Yes. Good.
Yes, I do.
Good answer. So what I recommend is SPF 30 for day-to-day routine, which is in and out of the car, driving around town, going to lunch. If you're going to be out all day at the beach or pool or outdoor activity or sports, then 50 or higher. Reapplying every 2 to 3 hours.
Okay.
So let's take a look with the mirror and tell me if you have any concerns.
So what has happened is this has fallen, you know, these wrinkles. And my crow's feet don't bother me that much, but
Okay.
you tell me what you see.
Okay. So in general, Botox is for the upper third of the face. Botox helps to relax muscles. So Botox can be used for the frown area, forehead lines, and around the eyes. I have a lot of patients that tell me that they like these lines or their expression lines or they earn those lines. So a few wrinkles are okay, a few lines are okay. So Botox can be used for those areas. And then in general, fillers are for the lower third of the face. So fillers help to fill or add volume. So they can work for lines around the mouth, the folds, vertical lip lines for women, can augment the lips. Another nice feature with fillers is we can put it here in the corners of the mouth and it helps to pick up that skin. So basically we're kind of putting that skin back where it used to be. So we can inject this area.
So I'm pretty typical. Gravity has taken its course.
Gravity's taken its course, and we just want to pick up that tissue and move it back where it used to be. So with these fillers, we call it liquid facelift. The combination of Botox and JUVEDERM literally can take 5-10 years, if not more, off a face. So by the combination of the two, they have a synergistic effect. So again, Botox to relax the muscles, fillers to fill in and replace lost volume.
And can you do it like all in one setting,
do
or
it all at the same time, really? Or some people like to do baby steps. And I always say Rome wasn't built in a day. So we can do Botox first, come back a few weeks later, do the filler. With filler, typically I recommend to put the full amount in that you need for full correction, because sometimes if you only put about half of what somebody needs, they're going to come back and say, oh, it didn't work. And it's not like it didn't work. We just didn't put enough in for full correction. But some people are a little apprehensive or nervous about the procedure, so that's okay. We can put a little bit in, and then I'll say come back in 2 or 3 weeks, and we can do a little bit more. You can always put more in. You can't take it out.
Do guys ask for different things than girls?
They do. So sometimes what bothers men is different than women. Women want, in some cases, upper cheek augmentation and lips, whereas men don't care about that at all. A lot of times men are more concerned about jowls or the frown. So this is a great area for Botox for people who have really deep furrows here. They call these the 11s. The combination of Botox and filler. So again, Botox is going to relax the muscle, prevent that contraction. So what that does is help prevent the lines from getting any deeper, and it helps to soften lines that you have. And then if you like the results and you keep up with it, ideally it's going to help prevent you from getting new lines.
And is there anything you can do here?
And then so back to this, we can also put a little filler in there. So if the lines are really deep, they're not going to go away completely with just Botox. You can fill them as well. And then for the neck area, there's a variety of lasers that are used for skin tightening. One is Apollo that we've talked about. We can put a little Botox in the corners of the mouth that helps prevent the downturn, the upside down smile. So put a little Botox there. And then we can also put filler, and it's an injection technique that I do called injectable thread lift, or now known as arc derma. And so rather than just tracing these folds, which can end up looking a little bottom heavy, so to speak, I'll inject going this way, and so it kind of sweeps that tissue, again, moves it back where it used to be, and it gives a nice lift to the jawline and kind of a little mini facelift, if you will.
Cool.
Yeah. Lots of options.
I like options. You
Options
can't
are
have too
good.
many, right?
Options are good.